right, let's jump right in. We all live our lives online, right? But there's this nagging feeling, this anxiety that a lot of us have. Is the internet, the thing that basically runs our world, responsible for the huge spike we're seeing in youth mental health issues? It's a question that feels really personal for so many of us.
And it's not just a hunch. When you have industry insiders, people like Facebook whistleblower Frances Haugen, coming out with statements this powerful, well, it just pours gasoline on the fire. The public concern here is absolutely through the roof. So that's the big question, isn't it? How do you actually prove it? It's a huge challenge for researchers, moving past feelings and headlines to find cold, hard proof. This is that classic problem of separating correlation, two things just happening at the same time, from actual causation, where one thing is really truly causing the other. To get to the bottom of this, we're going to look at a groundbreaking study that found a super clever way to answer this question by basically turning the entire country of Italy into one massive natural experiment. Now, what makes this study so powerful is the data they used. They didn't use surveys where people just say how they feel. No, they used objective, hard evidence. Every single doctor-diagnosed case from every hospital in Italy for over a decade. We're talking actual clinical diagnoses here, which is a total game changer. So, to really isolate the cause, the researchers had to get around that correlation trap. And the way they did it was, frankly, brilliant. You see, you can't just compare a town with internet to a town without it. Why? Well, because the towns that got broadband first were often richer or more urban. And those things, wealth, city life, could affect mental health all on their own. It's not a fair comparison. So here's where things get really clever. The researchers found a kind of historical accident. It turns out how quickly a town got broadband depended on how close it was to old telephone lines built decades ago. It was basically random. And by using that random distance, they could create a true apples-to-apples comparison, isolating the internet as the one big thing that was different. So they set up this incredible experiment. What did they actually find out about the internet's fingerprint? Well, the answer really comes down to a tale of two generations. They split everyone into two big groups. First, you have the older folks, who were already adults when high-speed internet showed up. Then you have the younger group, the ones who were teenagers growing up right as broadband was rolling into their towns. And the results? Wow, they couldn't be clearer. For the older group, the adults, getting internet access had basically no effect on their mental health diagnoses. Nothing. But for the younger group, the teens, the arrival of broadband was directly linked to a major increase in diagnosed mental disorders. To put a number on it, it was a 0.08 standard deviation increase. Now, I know what you might be thinking, 0.08. That doesn't sound like a lot, right? But in public health, when you're talking about millions of people, an impact of that size is huge. It is a very real, very significant negative effect on an entire generation's mental health. And when they dug in a little deeper, an unmistakable pattern emerged. The negative effects were almost all concentrated in people who got high-speed internet for the first time before they turned 20. It really suggests that our teenage years are this incredibly vulnerable, critical window. Okay, but this brings up a huge question, maybe the biggest one of all. Sure, diagnoses went up, but did the internet actually cause more mental illness? Or did it just make people more aware of problems they already had? This is the counter-argument you hear all the time, right? The idea that, hey, the internet gave us information, so it just helped people find a name for what they were feeling and finally get help. And you know what? It's a plausible theory. So the researchers knew they had to test it. So, to figure this out, they had to dive back into the data. They were looking for clues that could tell the difference between just more awareness versus a real increase in how many people were actually suffering. And what they found was, well, it's pretty sobering. The increase wasn't just in mild cases. The data showed a significant rise in severe, undeniable outcomes. We're talking about things like self-harm, suicide attempts, and even forced hospitalizations. These are not things you can just explain away by saying someone read about anxiety on a website. Okay, so we know it's a real increase, not just awareness. But what kinds of problems are we actually talking about here? The specific breakdown is really revealing. When you look at the details, you can see the damage was pretty widespread. There were increases in depression, anxiety, drug abuse, and personality disorders for both young men and young women. But, and this is a big but, there was one major difference. a sharp, unique increase in eating disorders that only affected females. All right, let's take a breath here and pull this all together. After going through this incredible natural experiment, what are the main takeaways from this landmark investigation? So here's the bottom line. The study found a clear causal link. Getting broadband early led to a rise in mental disorders. The effect was laser-focused on teenagers. And no, it wasn't just better reporting. It was a real increase in severe problems. But here's the real kicker. All of this happened before today's social media giants like Instagram and TikTok even existed. And that leaves us with a final, pretty unsettling question to think about. If that was the damage from the basic early internet, what in the world is the effect of the hyper-connected, algorithm-driven, always-on internet that we're all living with right now?